A recent model was developed to help hospitals forecast what they can expect as the cases of COVID-19 rise. I recently spoke with Annie Waldman, a reporter at ProPublica, about those findings.
It's been a bit of an abstract idea that we don't have enough hospital beds. So how did you and your colleagues at ProPublica go about calculating this?
Yeah, so this was a question that we really wanted to answer. When coronavirus starts spreading across the United States, how will our hospital capacity actually be impacted? And so we decided to collaborate with Harvard's Global Health Institute and Dr. Ashish Jha, who had data looking at hospitals in regions across the United States and what would happen under three different scenarios of infection. 20% of the population getting the disease, 40%, 60% over three different time periods. And this enabled us to see which hospital regions would be the most stressed once coronavirus hits the country.
So on your site here, you've got kind of 9 different maps. So really kind of upper left is the best case scenario. We only get 20% and it's over an 18-month period, right? So the map looks kind of green there. Things look pretty good. And then really in the opposite lower right corner, we see the worst case scenario, which is that we get 60% infection, and that's in 6 months. So even if we picked somewhere in the middle, we are still looking at lots of deep shades of red. That is above 100% capacity.
Right. And that's the most frightening thing about these projections is that even if you look at the best case scenario where the beds are, or where the infection rate is 20% over 18 months, our bed capacity will still be on average 95% full. That means in some regions, they'll need to double their beds or even triple their beds. In the best case scenario, where 40% of the population gets sick over 12 months, which would probably happen with the types of social distancing we're seeing today, we're still looking at having to double our capacity in hospital beds across the United States.
But you've also got kind of a dialog box right beneath there where people can just type in where they live. And then it's giving you kind of a bar graph of, again, with these different scenarios, and that's specific to the region that you're living in.
What we wanted to do was give the public an opportunity to look at their hospital system and see what the capacity would be like under these different scenarios. And what you find is that in some regions that are incredibly well-resourced, like Eastern Long Island, you will find that they will need to increase their capacity in a moderate scenario by 8 times. Which means that they will have to either build beds, create field hospitals, or decrease the capacity that they currently have in the hospital.
Because it's not just about whether you live in a big city, because big cities also come with big populations, right? So really your best bet might be kind of rural North Dakota if you can get to that hospital.
Well, there are caveats with that as well. Rural North Dakota, might also have the beds, but they won't necessarily have the expertise to handle the complex cases. So if you ask yourself, where would you rather be, North Dakota or Brooklyn during the coronavirus crisis? That's a good question. It kind of depends if you would rather have a bed that you can be in for sure, or a staff that has the expertise to actually deal with these cases.
Given the information that we have been seeing come out of, especially Italy, where you see these doctors really just at their wits' end saying, I'm doing the best I can and our hospital is drowning. How are American hospitals preparing?
We're seeing the news coming from China and Italy, and hospitals are trying so hard to create these plans to triage patients. There's going to be an influx of patients in the upcoming weeks. I've already been hearing from doctors that I've been speaking with that they've been expanding their capacity, trying to cancel all elective surgeries, open up other wings of the hospital. Some hospitals are thinking about how they can create hospital beds in untraditional places like cafeterias. And so, I think that they're really trying to prep for the influx of patients that are going to come in, but they're also struggling with a lack of resources right now. So gloves are in shortage, masks, we've heard about this, are in shortage. The CDC is now giving relatively softer standards for how doctors can prepare themselves. So we're seeing, essentially hospitals trying to prepare, but not necessarily being able to give in what they have on hand right now.
What about the notion of having these comfort ships come offshore in different places?
We're going to need all the resources that we can take at this point. It's not just about sailing those cruise ships into the Bay of Brooklyn or San Francisco. It's also about thinking about what kind of doctors around the world can we tap into? Can we rely on our Canadian friends, our friends in Mexico to help send doctors and nurses over to help increase our own capacity as we really take on this surge?
Annie, when you looked at the data and you've finally visualized all of it, what surprised you the most?
I think the thing that surprised me the most is just we have been talking about hospital capacity for a long time. You know, hospitals have been closing down. There have been, in rural areas, there have been mergers which have decreased hospital beds. And we really haven't been thinking about what would happen if a pandemic affected this country. What would happen if the 1918 flu were to strike now? And unfortunately, that lack of preparation has led us to where we are now. We are seeing something very similar to the early stages of the 1918 Spanish flu. And so we have to really think, you know, should we have been better prepared? And that's been the most surprising thing for me.
All right, Annie Waldman from ProPublica joining us from New Orleans tonight. Thanks so much.
Thank you so much.